These New York City centers facilitate the use of heroin, crack, and other hard drugs. The question is, does it help address America's drug problem? You walk in through the front door, you register, and you go wait your turn to go into the back room. There are tourniquets that you wrap around your arm, sterilized needles.
People have their favorites, they pick everything, they give them a booth, assign the booth. Once they go in the booth to use, that's their private time. We don't really pay attention.
Yeah. There's also a smoking room in the back. When I visited, there were people smoking crack in that smoking room. You're supposed to stay inside the facility and you are monitored, and if there is an instance of an overdose, staff can intervene. Now, I was told these staff members have intervened 2,100 times since this facility opened in 2021.
I used to say to the community, we responded to your request, and they would be like, no, we didn't want an OPC. So, but you didn't want public drug use. You didn't want people dying. You didn't want people using in parks, etc. We agree, we brought them in and loved them.
There are only 3 centers like this in the entire country, 2 in Upper Manhattan in New York City and 1 in Rhode Island.
It feels like an experiment because it is.
I also spoke to Led Black. He is a community activist. He lives about 5 blocks away from the second of 2 facilities, and he told me that he has 3 daughters and they shouldn't have to deal with people struggling with addiction on the stoop of their apartment building.
One of the statistics they cite is, well, we've overcome 500 overdoses.
It's actually up to 2,000.
2,000, right? But that to me, what does that mean, right? How many people have you gotten off of drugs? They never tell you that's that.
It's unclear if it's all On Point's fault that there are users and dealers drawn to this neighborhood. What members of the community tell me is that it does seem to be a draw. It's drawing people struggling with addiction, and it's drawing dealers.
Saritha Kamadareddy is running for New York State Attorney General as a Republican.
There's nothing safe about injecting yourself with heroin. We have no measurement of how many people actually get treatment. There's no evidence that anyone has gotten any treatment from these things. Instead, we keep funding them, and the legislature wants to expand them statewide. This is a tragedy. We have to actually get people help. And that's not what they're doing.
A congresswoman representing Staten Island sent this letter to then Attorney General Pam Bondi, asking her to shut the facilities down because she said by allowing for illegal drug use in-house, it violates federal law. There are no federal dollars that go to this facility, and that's because President Trump issued an executive order stating that there would be no federal dollars going to safe injection sites or overdose prevention centers like On Point. But there is city money funneling into On Point NYC through the Department of Health. They also get donations from foundations and elsewhere. They're pulling in annually, it looks like about $19 million. We saw what some of that money is going to. Well, they just renovated, and there are massage tables,
Aromatherapy,
a new hairstyling room. Proponents say that having On Point, a place where people can come in with nobody's judging them and they can just use drugs, removes a barrier to accessing the other health care that is on offer.
Having people come in here, have a spa experience in New York City, teaching and showing our people that they too can have all of this. They should have access to this kind of health.
Does this place actually reduce overdose deaths? If you look at studies looking at Vancouver, which has had overdose prevention centers since 2003, or in Europe and Portugal, some studies do measure a slight drop in death rates from overdoses, but that quickly kind of disappears when it gets mixed together with a wider population. So even the NIH's National Institute on Drug Abuse, they on their website say it is unclear whether such facilities reduce overdose death rates overall. Johns Hopkins bioethicist Travis Reeder told me that at the end of the day, even though the empirical data is unclear in terms of the overdose death rates, he and a lot of people studying them are proponents, and he told me why.
So here's what an overdose prevention site does. It says, you are welcome here, and I will watch over you so that you don't die today. And you're worth that. You deserve that because you're a human being and you have dignity. And I think that's a really beautiful thing